10. Alarming symptoms of diabetic foot complications. When it comes to managing diabetes, awareness is key. One aspect that demands immediate attention is the potential complications associated with diabetic foot problems. Ignoring these warning signs can lead to severe consequences, impacting not only the quality of life, but also overall health. In this comprehensive guide, we delve into the 10 alarming symptoms of diabetic foot complications that should never be overlooked. Number 1. Persistent tingling and numbness. Persistent tingling and numbness are sensory symptoms that individuals may experience, often indicating an underlying medical issue affecting the nervous system. These sensations typically manifest as a tingling or pins and needles feeling, accompanied by partial or complete loss of sensation in the affected area. The persistence of these symptoms may be indicative of various conditions, such as peripheral neuropathy, carpal tunnel syndrome, or herniated discs. Peripheral neuropathy, for instance, involves damage to the peripheral nerves, leading to abnormal sensations. Carpal tunnel syndrome results from pressure on the median nerve in the wrist, causing numbness and tingling in the hand and fingers. Herniated discs in the spine can compress nerves, leading to similar sensations in the limbs. Persistent tingling and numbness warrant prompt medical evaluation, as they may signify an underlying health issue that requires timely intervention. A thorough examination and diagnostic tests, such as nerve conduction studies or imaging scans, are often crucial in identifying the root cause and determining an appropriate course of treatment. Ignoring persistent tingling and numbness could lead to further complications, emphasizing the importance of seeking medical attention to address the underlying issues and ensure optimal long-term health. Number 2. Slow healing sores and wounds. The phenomenon of slow healing sores and wounds can be indicative of various underlying health issues and may raise concerns about the body's ability to repair and regenerate damaged tissue efficiently. Slow wound healing can be influenced by factors such as age, diabetes, circulation problems, and compromised immune function. Diabetes, for example, can impair blood flow and sensation, leading to delayed healing of cuts or sores. Additionally, conditions like autoimmune disorders or nutritional deficiencies may compromise the body's ability to mount an effective healing response. Persistent inflammation, often associated with certain chronic conditions, can also contribute to delayed wound healing. It is crucial to monitor and address slow healing wounds promptly to prevent complications, such as infections, which can further impede the healing process. Seeking medical attention for proper evaluation and diagnosis is essential, as healthcare professionals can identify the specific factors influencing the delayed healing and recommend appropriate interventions. Timely care and addressing any underlying health issues are key to promoting optimal wound healing and preventing potential complications. Number 3. Changes in skin color and temperature. Changes in skin color and temperature can serve as significant indicators of various health conditions and should be carefully observed for potential underlying issues. Skin acts as a reliable external reflection of the body's internal state, and alterations in color or temperature may signal disruptions in circulation, oxygenation, or other physiological processes. For instance, a bluish or pale hue in the skin, known as cyanosis, may indicate insufficient oxygenation of the blood and could be linked to respiratory or cardiovascular problems. On the other hand, localized redness or warmth may be a sign of inflammation, such as in the case of infections or injuries. Conditions like Raynaud's disease can cause skin discoloration in response to cold or stress, reflecting spasms in small blood vessels. Monitoring changes in skin color and temperature is particularly crucial for individuals with conditions affecting blood flow or those prone to circulatory issues. Any persistent, unexplained alterations in skin appearance or temperature warrant medical attention, as they could be indicative of underlying health concerns that require evaluation and appropriate intervention. Regular self-examinations and awareness of these changes contribute to early detection and management of potential health issues. Number 4. Swelling and redness. Swelling and redness are common signs of inflammation, which is the body's natural response to injury, infection, or irritation. Inflammation is a complex biological process that involves the release of various chemicals and immune cells to protect the body and initiate the healing process. When a part of the body becomes inflamed, increased blood flow to the area can result in redness, and the accumulation of fluid leads to swelling. This response is generally protective, isolating the affected area and promoting the removal of harmful agents. However, persistent or excessive inflammation can be indicative of an underlying health issue. Conditions such as arthritis, infections, allergies, or autoimmune disorders can contribute to chronic inflammation, leading to prolonged swelling and redness. Monitoring these symptoms is crucial, as they can be early indicators of a more significant health problem. Seeking medical attention is essential for a proper diagnosis and to determine the most appropriate course of treatment, which may include anti-inflammatory medications, lifestyle adjustments, or other targeted interventions to address the root cause of the inflammation. Number 5. Foot deformities. Foot deformities encompass a range of structural abnormalities that affect the shape, alignment, and function of the feet. These deformities can be congenital, meaning present at birth, or acquired due to factors such as injury, arthritis, or neurological conditions. Common congenital foot deformities include clubfoot, where the foot is turned inward, and metatarsus adductus, characterized by a curved or turned-in appearance of the front part of the foot. Acquired deformities may include conditions like bunions, where the big toe angles toward the second toe, or hammertoes, where there is an abnormal bending of the toe joints. Conditions such as rheumatoid arthritis can contribute to deformities by affecting the joints and soft tissues of the feet. Foot deformities can lead to pain, difficulty walking, and an increased risk of other foot-related problems. Management may involve orthotic devices, physical therapy, or in more severe cases, surgical intervention to correct the structural issues. Regular foot examinations and early intervention are crucial in addressing foot deformities to enhance mobility, alleviate discomfort, and prevent further complications. Seeking advice from a healthcare professional, such as a podiatrist or orthopedic specialist, is essential for an accurate diagnosis and appropriate management tailored to individual needs. Number 6. Pain and discomfort. Pain and discomfort are complex and subjective experiences that can arise from various sources within the body. Pain is often the body's way of signaling that something may be wrong or damaged. It can manifest as aching, throbbing, stabbing, or other sensations and may range from mild to severe. Discomfort, on the other hand, is a broader term encompassing any unpleasant feeling, whether it is pain, unease, or a sense of being unwell. Both pain and discomfort can result from injuries, inflammation, infections, chronic conditions, or even psychological factors. Understanding the underlying cause is crucial for effective management. Pain can serve as a protective mechanism, alerting individuals to potential harm, while discomfort may signal a state of imbalance or distress. Chronic pain or persistent discomfort requires thorough medical evaluation to identify the root cause and develop an appropriate treatment plan. Management strategies may include medications, physical therapy, lifestyle modifications, and, in some cases, psychological interventions. Addressing pain and discomfort holistically involves a multidisciplinary approach, often tailored to the individual's unique circumstances, emphasizing the importance of seeking professional medical advice for optimal care and improved quality of life. Number 7. Fungal infections. Fungal infections are common ailments caused by the overgrowth of fungi, which are microscopic organisms that thrive in warm and moist environments. These infections can affect various parts of the body, including the skin, nails, and mucous membranes. Dermatophytes, yeasts, and molds are the primary types of fungi responsible for infections. Skin fungal infections, such as ringworm, athlete's foot, and jock itch, often result in redness, itching, and the development of characteristic rashes. Fungal nail infections can lead to discoloration, thickening, and brittleness of the nails. Candida is a type of yeast that can cause infections in the mouth, oral thrush, or in the genital area, yeast infections. Factors contributing to fungal infections include weakened immune systems, poor hygiene, use of antibiotics, and underlying medical conditions like diabetes. Treatment typically involves antifungal medications, either topical or oral, depending on the severity and location of the infection. Preventative measures include practicing good hygiene, keeping the skin dry, and avoiding prolonged exposure to damp environments. While most fungal infections are not serious, recurrent or persistent cases may require medical attention to prevent complications and ensure effective management. Number 8. Limited range of motion. Limited range of motion, ROM, refers to a condition in which a joint or multiple joints have restricted movement beyond their normal range. This can affect various parts of the body, including the neck, shoulders, elbows, hips, knees, and ankles. There are several factors that can contribute to limited range of motion, such as injuries, joint inflammation, muscle stiffness, arthritis, or the presence of scar tissue. Injuries, whether acute or chronic, can lead to swelling and the formation of scar tissue, restricting the normal movement of the affected joint. Chronic conditions like arthritis can cause inflammation, pain, and gradual degradation of joint structures, limiting their flexibility. Muscle imbalances and tightness can also contribute to restricted movement. Physical therapy is often a key component in addressing limited range of motion. Therapists use targeted exercises, stretches, and manual techniques to improve flexibility, strengthen muscles, and enhance joint mobility. In some cases, medical interventions, such as joint injections or surgical procedures, may be necessary. Early detection and intervention are essential to prevent further complications and improve the overall function of the affected joints. Individuals experiencing limited range of motion should consult with healthcare professionals, such as physical therapists or orthopedic specialists, to determine the underlying cause and develop an appropriate treatment plan. Number 9. Burning sensation. A burning sensation is a discomfort or pain characterized by a heat-like or scalding feeling often accompanied by redness and irritation. This sensation can occur in various parts of the body and may be indicative of different underlying causes. Commonly, it is associated with nerve-related issues, such as neuropathy, where damage or dysfunction of peripheral nerves leads to abnormal sensations. Conditions like diabetic neuropathy or sciatica can give rise to a burning feeling in the extremities. Additionally, skin conditions like contact dermatitis or sunburn may cause localized burning sensations due to inflammation or irritation. In some cases, muscle strains or injuries can elicit a burning discomfort. It's essential to consider both neurological and dermatological factors when evaluating and addressing a burning sensation. Seeking medical advice is crucial for a comprehensive diagnosis, as treatment varies based on the underlying cause. Management may involve pain relief medications, topical treatments, physical therapy, or addressing the specific condition responsible for the sensation. Ignoring persistent burning sensations can lead to complications or the progression of underlying health issues, underscoring the importance of timely medical attention for proper evaluation and targeted intervention. Number 10. Unexplained ulcers. The presence of unexplained ulcers, particularly in the gastrointestinal tract, can be a cause for concern and warrants thorough medical investigation. Ulcers are open sores or lesions that develop on the lining of organs, commonly the stomach or small intestine. While peptic ulcers are often associated with Helicobacter pylori infection or prolonged use of nonsteroidal anti-inflammatory drugs, NSAIDs, unexplained ulcers refer to those without an apparent cause. These ulcers may be indicative of more serious underlying conditions, such as inflammatory bowel disease, IBD, Crohn's disease, or in rare cases, certain types of cancer. The symptoms of unexplained ulcers can include abdominal pain, bloating, nausea, and changes in bowel habits. Diagnostic procedures, including endoscopy and imaging studies, are essential to identify the location, size, and characteristics of the ulcers. Once diagnosed, appropriate treatment strategies can be implemented, ranging from medications to lifestyle modifications or, in severe cases, surgery. Given the potential seriousness of unexplained ulcers, seeking prompt medical attention is crucial for accurate diagnosis and timely intervention to manage the underlying condition and prevent complications. In conclusion, various health conditions manifest through distinctive symptoms, each serving as a valuable indicator of underlying issues. Persistent tingling and numbness can signify nervous system abnormalities, demanding timely evaluation. Slow-healing sores and wounds may reflect compromised healing mechanisms, emphasizing the importance of identifying and addressing the root causes. Changes in skin color and temperature act as external markers of internal imbalances, requiring attention to prevent potential health complications. Foot deformities, whether congenital or acquired, impact mobility and necessitate multidisciplinary care for optimal outcomes. Pain and discomfort, complex subjective experiences, prompt individuals to seek medical guidance for comprehensive management and improved quality of life. Fungal infections, prevalent in various forms, call for timely intervention and preventative measures. Limited range of motion often stems from injuries, inflammation, or muscle imbalances, underlining the significance of early detection and tailored interventions. A burning sensation indicative of various conditions highlights the need for comprehensive medical evaluation to address the root cause. Finally, unexplained ulcers, particularly in the gastrointestinal tract, demand thorough investigation as they may be linked to serious underlying conditions, reinforcing the crucial role of prompt medical attention for accurate diagnosis and targeted intervention in preserving overall health and well-being.